Welcome to Marian Ayurveda. In this episode, we are going to discuss a problem that many people face with their knees. When you bend or straighten your knee, you hear a lot of sounds coming from inside it. Whether this should be taken seriously or if it will lead to a major bone problem is a big concern for many people. In this video, I would like to explain what exactly is happening there and what the Ayurvedic solution for it is. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. We know that for various reasons, sounds can come from inside the knee joint. The first basic reason for this is that when you bend your knee, gases are released from between the ligaments or from the tendons of the muscles. Various types of gases are released. So the cracking or popping sounds you hear are actually the sounds produced when these gases escape out like this. That is not necessarily a sign of any major bone disease, but if you frequently hear these kinds of sounds when you bend or crack your joints like this, it could mean that some degenerative changes are happening more than usual. That is, if you start hearing more sounds as you get older, it could indicate a tendency towards that in the future, or it could mean that the strength of the muscles is decreasing. We can interpret it that way if needed. So if such sounds are occurring, and if someone feels this way according to Ayurveda, and if the sounds are due to the muscles releasing more gas, then we can try regularly applying oils like Danvantaram Thailam or Kashirabala Thailam. If those sounds decrease, then in Ayurveda, this is referred to as a Vata disorder. Otherwise, there are people with a Vata constitution, or some people by birth, who will always have sounds when they crack their knuckles or other joints. They are the ones with a Vata constitution, that is, people who are lean by nature, who move around quickly and have a body type that is always active and fast moving. From birth itself, they are the kind of people who can make sounds from any joint, or who naturally have joints that make sounds. These are the people we refer to as having a Vata constitution. There may also be people like that who are quite stout, but if over time these kinds of sounds from inside the knee start to increase, the very first thing we should do is to try applying oil and see if that helps. Similarly, if such sounds are increasing from a person's knee, try taking 1 teaspoon of sesame oil daily. By doing this, we can reduce the increase of Vata in that area, or we can help reduce degenerative changes. Secondly, another point is about the cartilage. That is, we often wonder whether this sound is coming from the bones rubbing against each other. Usually bones cannot rub against each other that easily or quickly because there is a large cartilage, a kind of soft tissue between our bones. There is a large cartilage between the bones that helps us bend and straighten our legs very smoothly. So as long as that is present, our bones do not rub against each other. But sometimes when this cartilage is completely lost and the bones start rubbing against each other, it becomes a very painful condition. It is in such situations that we often have to undergo knee replacement surgery. Otherwise, to a certain extent, in about 90% of people, the cartilage behind the bones in the knee undergoes a slight liquefaction. And when it liquefies and loses its smooth surface, there is a chance that sounds like crepitus may occur there. For people like that, we can say to follow the good treatments as mentioned earlier. The first important thing is to think about why this cartilage suddenly liquefies. Sometimes it could be due to excessive acidity in the body. Or it could be a problem in the body or in the digestive process where the food you eat is not properly digested, and as a result, the cartilage does not receive enough nutrients. Or after a major fall, if fluid accumulates there and does not drain properly, that fluid, just like how we know that if water remains stagnant on a tree for a long time, the tree will rot. In the same way, the cartilage here starts to dissolve. So in this way, if we identify the reason why the cartilage is dissolving and treat it accordingly, we can prevent the degeneration of this cartilage. Similarly, if the functioning of the muscles goes wrong, that is, if there is a displacement of the muscles that move the cartilage in the knees, then the cartilage can rub against each other, increasing the chances of further degeneration or damage. So this is actually a somewhat more complicated matter. This is something we need to understand by consulting a doctor. The third issue to mention is the problems that can occur with the ligaments. That is, injuries to the ligaments. That is, there is the ACL, the PCL, and then the lateral collateral ligaments. There are many such ligaments that hold and stabilize our joints. If there are injuries there, or if they become lax, that is loose, then the functioning of the knee joint becomes impaired, and this can lead to sounds or the release of gases from within, as well as an increase in joint space. Therefore, we can understand whether such problems exist through an MRI scan. Similarly, through other tests as well, such as for the ACL, which is the anterior cruciate ligament, or the posterior cruciate ligament, we can determine whether these ligaments are functioning properly, whether they are loose, or if there are any injuries or fluid accumulation in them. We can understand if these are the reasons for the sounds being produced. Similarly, in some individuals, what we feel is that the movement or movement shift of the patella could be the reason. That is, there is a groove where it is supposed to move. There is a specific path for it. But if, for example, the muscle suddenly, say, the leg slips and is about to fall, then the movement of the muscles, the way the muscles move, will change a bit. So when the muscles attached to the patella pull the patella and it moves along paths other than the one it is supposed to, the bones can rub against each other and the patella and other structures can rub together, causing sounds to occur. So what we need to do here is check whether the muscles are working incorrectly, correct the function of these muscles, and bring the patella properly into that groove. Once that's done, it is possible to eliminate the sounds in the knee caused by the patella. In my experience, many times when patients come to us, they have these kinds of sounds. Often when we examine the muscles, we find that they are functioning incorrectly. If we are able to properly hold these muscles, or if we can correct the alignment of the muscles, I have seen that these kinds of sounds suddenly decrease. Similarly, for some individuals, if the issue is due to degenerative changes, when treatments like Pijichil, as mentioned in Ayurveda, are administered, it has been observed that the activity of these gases or the functioning of the gas decreases rapidly, and we have even been able to eliminate these sounds quickly. So Pijichil is considered a very effective treatment. If good massages that help restore the muscles are given, the activity of this condition can be reduced. Similarly, regularly consuming 1 teaspoon of sesame oil is good for people with a Vata constitution. That is, for thin individuals who experience sounds coming from their joints. Taking 1 teaspoon of sesame oil is beneficial. Likewise, applying oils like Dhanvantaram or Kshiravela is also very good. However, when we apply oil, there is one thing we must pay attention to. Just make sure not to apply it when there is swelling or fluid accumulation. That is, if you apply oils when there is fluid present in the knee, it can actually worsen the condition. If there is no such fluid, then you can confidently apply oils to strengthen the knees. So I think you must have understood by now. Now we have discussed 4 reasons. I believe we now understand what the treatment is for each of these 4 reasons. Let's meet again in another episode. Thank you.